Thank you so much. That was a lovely introduction. Thank you. Thanks especially to the Division of Nutritional Sciences and to the White family, really, for making this possible and supporting this visit. It's been a wonderful trip down memory lane for the last 24 hours or so. I've really enjoyed visiting with a lot of you, and I'm honored to be here today to tell you about some of my team's work. Related to access to healthy foods, particularly in low-income and underserved communities, and especially with regard to healthy food in corner stores. So just as a very broad outline for today, I'm going to talk briefly about what's the importance of corner stores, why do we care about them, why do we think they're important. I'll move on to talking about healthy corner store programming, specifically in Minneapolis and across the country. These are really boots on the ground kind of strategies that are giving technical assistance to store owners in stocking healthy food. And then finally, I'll lead into some areas of policy action that really have the potential to have some important impacts on corner stores and small stores in terms of the food that they offer. Those are the broad highlights for the talk today. What you're going to see also is a sub-theme running throughout the talk, and that's this idea of comparing and contrasting national versus local perspectives. We think about things often coming either from a bottom-down approach or a top-up approach, but what we've seen in this work is that there's a real capacity for complementary approaches where we can learn a lot from each other, and that's come together in really important ways in this research portfolio that I want to try to highlight and draw out. In terms of the national perspective, as Carol mentioned, we have this national collaborative of scholars that I'll tell you about, where we've conducted multi-city studies for several years now across a variety of angles related to corner stores. We've also done some investigation into federal policy impacts on small stores in particular. And then on the local side of things, we've really been able to dig in and get engaged with a lot of exciting stuff that's happening in Minneapolis in particular related to access to healthy food, much of which is being driven now by the local health department, the city health department. Also by a variety of supporting organizations in the city. So again, I'll tell you about the Minneapolis Healthy Corner Store program. We also have a very unique policy situation right now in Minneapolis that I'm particularly excited about. That's the Minneapolis Staple Food Ordinance, so I can dig in a little bit there. I will say that from a local perspective and the extent to which we're able to complement our national work with local work really hinges on effective government-university collaboration. And so as you'll see as I move on too, we have a very strong collaborative relationship with the Minneapolis Health Department, and this work really highlights a lot of what they're doing in the city as well. So why are we interested in food access? The bottom line, as many of you I'm sure know, is that there are fundamental inequities in who has access to healthy food in the United States. So not everyone has equal access. There's been a lot of literature on this topic, and it's really strikingly consistent across the research findings. So for example, supermarkets are less likely to locate in communities of color and also low-income communities, whereas corner stores and convenience stores and fast food restaurants are more likely to locate in these communities. And we think that these relationships and these disparities could potentially play an important role in some of the disparities in health outcomes that we really care about and think a lot about. Having said that, the scientific community has had a number of challenges in assessing significant and broad changes to food environments, specifically improvements in healthy food access, and the impact that directly has on health outcomes. But there's a number of studies that are in the works now that I think will really shed some light on this in the next few years, including some of the work that our team's going to be doing, evaluating a natural experiment that's about to happen. I will say, despite these kind of challenges with doing this kind of work, the Institute of Medicine, the Centers for Disease Control, other leading authorities in the field have really come out and said that access to healthy food is one of the key areas that communities need to be addressing in order to be dealing with the issues of obesity prevention and also health promotion in a broad kind of population perspective. So in terms of small urban corner stores, we think these, and we know these are really important venues, particularly in inner city communities, often which lack access to supermarkets, lack access to large food retailers where people often do their shopping. Excuse me. These are venues where residents may do their primary grocery shopping, their primary food shopping for their family. They may be facilities where people do a number of fill-in trips throughout the week or throughout the month to get them from grocery shopping trip to grocery shopping trip. But we know that people in low-income communities are frequenting these kinds of stores. We also know that they're less likely to stock healthy food, right? Traditionally in these stores, we see a lot of energy-dense, pre-packaged items. We often see tobacco and alcohol in these stores as well, and less in the way of healthy products, particularly perishable products. So there's some real kind of avenues for opportunity for working in these settings in a public health capacity. Just a note about definitions in terms of what constitutes a corner store. There really is no standard definition for defining a corner store. And my colleagues and I have spent a long time thinking about this and debating this, and for a while we realized we were working under the we'll know it when we see it kind of mentality, and we've tried to do better than that. We've defined it in a number of ways in our published work. So for example, we sometimes define a corner store as a store that only has one, possibly two cash registers. We've also defined a corner store as a store that has 5 or fewer aisles, and in Minneapolis and St. Paul, these are often very short aisles that are located in a relatively wide store. So we're talking about a small overall footprint for the store. But there really is no standard definition. People use different terms in the literature. Some people refer to these as convenience stores instead of corner stores. And in fact, my team has really been shying away from looking exclusively at corner stores in my more recent years, and really has started focusing on small retailers in general. So that means that we're being inclusive of other kinds of stores where people are really, as it turns out, buying a lot of food. Places like gas marts and pharmacies and dollar stores that are other important venues in these types of settings. So here's an image that depicts the members of the Healthy Corner Store Working Group that Carol had mentioned. In 2007, Mary Story asked me to convene, along with Joel Gittleson, this Healthy Corner Store Working Group, national network of scholars who are investigating a variety of issues around corner stores and small stores in terms of food access. As you can see, we've had a variety of sites added over the last few years. We've collaborated on a number of different studies with different sites coming in and out of different capacities. But it's really been a rich resource, I think, for moving the field forward, generating ideas, and then being able to evaluate those ideas in a systematic and multi-city, multi-region kind of way. The first study that we did, we were just starting out. We had 4 sites, so Minneapolis and St. Paul, Baltimore, Maryland, Philadelphia, Pennsylvania, and Oakland, California. The first study we did, we just got together and we said, you know what? Are healthy foods available in corner stores? At that point in time, we really didn't know. Clearly, there was a lot of evidence mounting to say there's unhealthy foods available, but we didn't really have a perspective on how many healthy items, how many stores had some healthy items, if they had healthy items, how many items did they have, and kind of a starting off point for a lot of our work that would follow. So we went into stores in these 4 sites. We did brief assessments in over 100 stores to just get at this question of what foods are available. These are data from the Twin Cities site only, where we see when you look at unhealthy items, so for example, I have regular potato chips here as kind of a benchmark of unhealthy foods. You see clearly almost all the stores carry some unhealthy products. But then when you start looking at healthier items, we see half or fewer of the stores carry many of these items. Yogurt, applesauce, salad, fresh fruit, fresh vegetables, etc. And And when we pull the data together from the 4 different sites, we see, in fact, echoes of these findings. Healthy foods and beverages, including both snack foods that are meant to be consumed immediately, as well as staple items that are intended to be taken home and consumed at home or used for home food preparation, were really not available in a number of stores. And when they were available in stores, the selection was really, really limited, either in variety or quantity. There's really not much that we saw in these stores. So that's kind of the glass half full, the glass half empty kind of approach. If you look at the glass half full kind of approach and think about the silver lining on this, which I think is important, there were some stores that were stocking healthy food, right? So it might not be a lot. They might not have a lot of variety. They might not have a lot of supply, but 50% of stores had a fruit or a vegetable. Maybe it was, a basket of bananas. Maybe it was a sack of potatoes in the back, but there was some distribution mechanism in place. There was some model of this working successfully in some form. So we're not totally starting from ground zero in these cases. And I at least thought that was at least a glimmer of promise with these data. We also saw significant variability by store size and by geography. And this may seem like a really intuitive thing, but at the time it was really important for us to confirm that this was true, in that the larger the store, the more likely they are to be stocking healthier foods in these categories. These are all convenience stores, but again, convenience stores come in a variety of sizes. Here you're looking at, the bars here represent healthy food availability scores. So the higher the bars, the more healthy foods are stocked in these stores. And you can see pretty clearly there are significant differences between single aisle stores, 2 to 5 aisle stores, and then larger stores that are 6 or more aisles. So we really kind of confirmed this sense that we had from the anecdotal literature that it's the small stores that are needing the most help, though everyone needs to improve. We really need to be coming up with programming to support the smallest stores in particular. Interestingly, we also saw geographic variation that to some extent overlapped with the store size issue and to some extent was independent. So for example, in Baltimore, there's a lot of these single aisle stores that we really don't see very often in the Twin Cities. And we kind of noticed beyond just our crude measures of store size that there really were some differences site by site in what stores look like and what they didn't. And in fact, we got to the point at one point where we said, we just need to take pictures of our stores and send them around to all of our sites so I know what you're talking about when you say this is what my store looks like. And it was really kind of informative. So anyway, it gave this sense that there's some kind of local context that's really important to consider in thinking about corner stores. And that finding, I think, lends itself really well to this idea that's popped up over the last 5 or 10 years, these kind of programming efforts. Minneapolis has a healthy corner store program, but there's healthy corner store programs across the country that really kind of have emerged as grassroots issues. Local governments, local nonprofits, local community organizations have come together to provide assistance to small stores and help them improve their food offerings. And so I'm just going to give you an example of what the Minneapolis Healthy Corner Store program looks like. This is a program that is owned and operated by the health department in Minneapolis. As a university partner, my team has come in and partnered with the city health department on some of their in-depth evaluation efforts that they've done, which I'll tell you about. We've given input on various programmatic activities, but this is really a health department initiative. So I just want to kind of acknowledge that before moving forward. The program has been implemented in 3 phases. In the first phase, there were 9 stores that the health department was working with. And the goal was really to support owners and managers in making fresh produce, fresh fruits and vegetables, visible and attractive in the stores. Then in phase 2, the health department was really interested in how can we scale up these efforts? It's all well and good to work with 9 stores, but we really need to think about more of a public health model where we can launch this to a new level. And so they had an expanded reach. They partnered with a variety of community-based organizations and neighborhood organizations that then acted as liaisons between the city health department and the stores. And they were in 30 stores in phase 2. And then in phase 3, which is going on now, they've gone back to kind of more of an intensive format with a small number of stores, 10 stores in particular, because there was a real desire on the part of, we heard this from community members in particular, to have kind of model stores and really invest a lot of effort into specific model stores in the community. And then this will be coupled with a larger, more diffuse dissemination effort to help corner stores more broadly with programming in the city. The stages of the program are as follows. Stores are recruited. The city puts out an RFP. Stores can apply to be a part of the program. They go through an interview process. They're recruited into the program, and then they go through a really in-depth assessment with city staffers who evaluate. They audit the store. What do they have available in a really detailed way? What are the strengths? What are the weaknesses? What are the opportunities for change? They do in-depth interviews with the store managers and owners and really try to get a sense for what the store is all about, right? And then we move on to the store enhancement after that initial kind of assessment has been done. The store enhancement can take a variety of different shapes depending on what the store needs and what the city staffers and the store owner agree is kind of would be the most effective strategies to try out in their store. So there's kind of a menu of options that can be decided on. Some of the things that have been done are merchandising and using displays to make healthy food more visible and attractive. You know, often it's just a matter of pulling healthy foods into a central portion of the store, making sure they're displayed all together, making sure they're organized and people can tell what's what and they're visible. Here's one of our corner store owners from phase 2 who's standing by his produce display. The rack that you see in this display was donated by the city health department through his participation in the program, as well as signage and window clings and shelf tags. These displays are immediately adjacent to the front door of his store. This cooler here used to be used for sugar-sweetened beverages and was repurposed for fruits and vegetables upon the store enhancement. There also was in-store advertising and promotion provided by the city, so signs and window clings and all kinds of things. Cross-merchandising, bringing healthy foods together that might be purchased together to incentivize kind of the purchasing of multiple items by customers. Creating opportunities for impulse purchasing, so pulling some of the fresh fruits in this case up to the cash register so they're within arm's reach. And also identifying new sources for distribution and delivery. I don't have enough time to talk about this in detail here today, but I'm happy to talk with anybody who's interested afterwards. The city has tried a number of strategies to increase distribution options for stores. They're still experimenting with some new options, and so there's a variety of different strategies that can be employed here. And then finally, there's a community engagement piece where neighborhood organizations and community-based organizations, here you see Appetite for Change, which is a local neighborhood organization in North Minneapolis, doing taste tests and cooking demonstrations and neighborhood events and really trying to drive awareness in the community that these stores now stock healthy food, because if people don't know that you stock healthy food, then that inherently creates a problem with demand, and really trying to drive up purchasing from the community side of things. For the store enhancement and the community engagement piece, those pieces took place over about a 6-week period with city staffers and the program staff on this project all have retail experience. City staffers going into the store at least once a week to have regular touch points with the store owners and find out how things are going. Now, I had mentioned this before, but we partnered with the health department on some of their evaluation effort, and this is an example of where our partnership was kind of was strongest. We had the greatest involvement. We partnered with the city in doing a sub-study during the phase two implementation of the project using point-of-sale data collection. It's objective data collection of sales receipts. This is really difficult to do in corner stores, and very few sites have done it so far because it creates so many challenges. But we initially wanted to run this as kind of a small feasibility trial to say, can we do this in a larger setting? And so what we did is we selected 7 stores into the program that already had point of sale cash registers in the stores and operational, but they weren't really being used to itemize checkouts. Most things were just being wrung out under a general grocery category. And so we hired a grocery store consultant to come in, reprogram the machines, train staff and owners to ring out produce into a separate category. So then we could track sales of produce in particular over time. We had to track these by paper copies of receipts that were printed out on a daily basis by the store owners. We had a staffer at the health department, who was also one of my master students, go to the store every week and go through these receipts and get these data. So again, as you can see, it's not an easy process, but we were able to get sales data over a 14-week period to describe sales of fruits and vegetables in particular. And so what you're looking at here are fruit and vegetable sales as a percent of total store sales. And in the left-hand portion of the graph over here, you're looking at baseline data, so before anybody got any intervention. Then at this central dotted line is where we had 5 intervention stores get our store enhancements as part of the program. And then in weeks 11 to 14, this is post-intervention follow-up. And after 14 weeks, our 2 control stores that were in the sample got a delayed intervention. So the lines here, the blue line are the control stores, the 2 control stores that received that delayed intervention, and the red line here are the intervention stores that got the intervention after 4 weeks. And what you can see is that it appears as though sales are increasing over time with the intervention stores, and in the control stores there looks like there's maybe just a bunch of noise in the data over time. And so, we saw that fresh fruit and vegetable sales as a percent of total sales increased 155% in the intervention stores compared to declines that we saw in the control stores. We also saw significant increases in fruit and vegetable transactions as a percent of total transactions. So that's just, does a given purchase have a fruit and vegetable as part of it? And we were also able to get redemption data of WIC vouchers at the state level with the store's permission. And so we saw changes in the directions that we would expect with the intervention stores having more WIC redeemed fruit and vegetables there after the intervention. We also did over 200 customer intercept surveys in these stores at post-intervention only, and we saw a variety of things, one of which is more favorable perceptions of neighborhood fruit and vegetable availability in these stores in intervention compared to control. These stores were all located generally within the same within the same region of the city, within the same neighborhood, yet we saw these differences in customer intercepts. So in general, in some, we have small sample sizes here. We were just doing this as an exploratory study, a feasibility trial, but we see results that are pointing in the right direction, right? We see results that are consistent with other corner store studies that maybe haven't been able to collect objective sales data, but have been able to collect sales data through store owner self-report and other kinds of methods. So it seems as though these programming efforts are headed in the right direction. My colleague Joel Gittleson recently published a review of the literature and again found that there are promising findings related to these corner store programs. I will say that we're seeing relative effects that are significant. We do have a problem of absolute effects, though. We're looking at fruit and vegetable sales that are less than 0.5% of total sales. So we're seeing an improvement, but it's still really low. So there's a lot. I don't want to mask what's really going on here. There's a lot of work that is yet to be done in this area, and a number of factors that have to come together. But at least it seems like we're headed in the right direction. One thing that I noted after having seen this kind of work and seeing all the hard work that the health department poured into this initiative and seeing sites across the country and everything they were doing, one thing that I noted about healthy corner store programming was, gosh, there are a lot of challenges to doing this kind of work. There are a lot of barriers. These are tough settings to work in, and it's not that easy. And what I also noted was it seemed like corner store programming was becoming really popular, and yet people by and large, particularly academics in the scientific community, didn't really have an appreciation of how hard it was. So we were seeing, grant proposals and other kinds of proposed work where people clearly didn't realize the barriers and the struggles that would be instrumental in having a successful program. And in terms of dissemination to the scientific community, those aspects, those logistical aspects of running this kind of program, that's the stuff that gets left out of scientific publications. That's the stuff that gets left out of presentations at national conferences. We just kind of don't talk about that stuff, right? So we went back to our national network of scholars and said, we really need to do a better job at disseminating some of these challenges. And so we got 4 sites together to do an in-depth qualitative case study analysis where we had 4 sites across the country that had experience doing this kind of work, and we came together and said, let's just identify what the challenges are and kind of lay them out. We had 4 sites: Baltimore, Minneapolis, Burlington, North Carolina, and Philadelphia, Pennsylvania. These sites have common elements in terms of the programming that they offered, but they also had a variety of different elements. So, several of these sites were fairly moderate in size in terms of the number of stores that they were reaching out to. One of these sites, Philadelphia, was very large. They reached out to over 600 stores in 2010. So they've had a lot of stores come through their program. We had some programs here, for example, in Minneapolis, programs that are run by the health department, some programs that were run by academics who got an NIH grant to do it. And so we had some nice heterogeneity in here that let us really kind of explore some of these issues with enough variation to pull out what we felt was important. And through the qualitative work that we did, we established key areas that we were interested in drawing attention to, and you'll see those in blue in the next few slides that I'll go to. And then in bullet points underneath the blue, you'll see the themes, the common themes that emerged. And I have to say, I just have selected, I think, the themes that I think are really important to highlight here, but there's much more than this in this paper. If you're interested in corner store work, I would really strongly suggest that you look at this paper. I think it's such a rich piece and so much detail in here. Really a valuable contribution to the literature, I think. It was published just this year in American Journal of Health Behavior. So when preparing for a corner store intervention, when preparing to launch, really important to allot enough time to work with corner store owners, to build trust, to build relationships, and to do those things before moving forward. Some of these principles, that's kind of a common sense thing, right, of working with the community in general, that you need partnerships in place, you need to build trust. But you see a lot of people who are trying to rush through the process, maybe for very legitimate reasons, but really it takes time to build these relationships. Also potentially important to match cultural and linguistic characteristics of store owners with the staffers, the program staff that you're sending into the store. What we see across the country is that often the cultural background of the store owner does not match the background of the customers that they serve and or the community at large. So for example, in Minneapolis, we have a lot of Middle Eastern men who have immigrated to the United States at some point during their adult life, running the corner stores. And it's important when possible to certainly at least acknowledge that cultural difference and match the cultural relationships when you can. This is true also about thinking about the complexity of the store owner-customer relationship. This is an area where Joel Gittleson in Baltimore has done some really interesting intervention work, thinking about how to enhance communication and relationships between Korean American store owners and the African American clientele that they serve. Really important to acknowledge these differences. And also kind of a basic issue, but consider the store owner's perspective when designing the program. There has to be flexibility in the program process. These store owners, it's their livelihood, and they have a lot of expertise in running a small business. Finally, in terms of preparation, beginning with formative work is critical. Consider starting slow and building over time. All of your intervention components don't need to be released at once, considering kind of doing a staged approach. And clearly the supply and demand side of things are very important, considering demand in addition to considering supply. In terms of implementing programmatic activities, this issue of just establishing a supply of healthy food in the store is deceptively complicated. Identifying distribution sources, identifying delivery systems, making sure that they're at price points that the owners can manage. These are all really complicated factors that take quite a while to sort out. And in evaluation, we've seen across the board that a variety of process measures, measuring store availability of healthy foods, measuring marketing or point of purchase advertising or those kinds of things is very feasible, even with pretty small programs. But obtaining reliable data, as I mentioned before, on things like objective sales is really quite difficult. So here's where a community university partnership, for example, may be very valuable. And finally, in thinking about moving ahead with future planning, store maintenance is an ongoing challenge. We really think there needs to be continued reinforcement of activities. So again, we had staffers going into the store every week, if not more than once a week, to continually check in. How's it going? Looks like this isn't working. Can we fix this? What can we do? And unfortunately, when those visits stopped, sustainability became much more problematic. So we need to figure out a way around this, and I don't know that anybody really has yet. One solution potentially is to think about larger infrastructure or systems level changes that can take place to support these changes over time, even when the reinforcement ends. So getting into a delivery system that's just automatic, the healthy food stock comes every week, the store owners don't have to continually go in and order supplies week after week, can potentially be something to explore. And then finally, dissemination across a broad range of audiences is important. And again, the sustainability piece just keeps coming up. We need to figure out how to make sustainable programs over time. What we're realizing, we're realizing is that, again, these programs are challenging. They also take a lot of staff time, if you haven't guessed from everything I've said so far. They really take a lot of programming support. And so it's challenging to think about not only how this program can be maintained, how these activities can be maintained once the program ends, but also to think about that issue of scaling up. How could you really bring this to scale in a way that's reasonable given the budgetary constraints that are generally faced? And so one direction that this field has gone is thinking about policy efforts. How could we use policy efforts to bolster the efforts of programmatic activities and use them to support and supplement what's going on in individual communities? And this is where I want to tell you a little bit about something very unique that's going on in the city of Minneapolis and has been going on for several years. We have a staple food ordinance in the city, and to our knowledge, there's no other city in the country that has an ordinance like this. The history behind this, it came about in 2008 when there were city council members in Minneapolis that realized there were a number of stores that were licensed as food stores in the city, and yet they really didn't stock much food, and they were serving as fronts for criminal activity, for problematic things, frequent police reports. And city council said, we need to do something about this. So we need to make sure if we give you a license to sell food, we want to make sure that you're actually selling food. And so with a few exceptions, stores that are licensed as food stores in the city of Minneapolis have to stock a series of types of foods. And so, for example, they have to stock at least 3 varieties of bread or cereal, 3 varieties of dairy or alternative dairy sources, at least 5 varieties of fresh fruits and vegetables. There's also a meat category that I didn't include here, 3 varieties of meat. Now, so this is currently on the books right now, this ordinance. And the fruit and vegetable component has been really effective with the Healthy Corner Store program. So it's let the program, the staff, go in and say to store owners, you know, you're required to stock 5 kinds of fruits and vegetables anyway. Let us help you do it better. You know, let us help you do it in a way that's going to sell, that's going to help your bottom line. And so it's been a really motivating kind of piece to the program. The challenge, and what's been acknowledged, is there are a number of loopholes to this policy. There's no minimum quantities on any of these standards. They're really not linked to nutrition criteria, you know, in a way that we think is important or would align with the dietary guidelines or other kinds of recommendation for health. There's also some loopholes in terms of who is exempted from the policy and who is not in more of the technical language. And so there's been a real recognition in the city and in the health department that we need to do better. But there's a revised ordinance that's on the books right now that has not passed but is being proposed, whereby these regulations will be strengthened dramatically. So in terms of thinking about, you know, breads, there are whole grain products that are required. In terms of thinking about dairy, it's low-fat or fat-free dairy. In terms of fruits and vegetables, it's with all of these criteria, there's minimum amounts that are required. So it's at least 30 pounds or 50 items of fresh fruits and vegetables in 7 varieties, 5 of which must be fresh. And overall, there's 10 categories of food that these stores would now have to meet in order to be in compliance with the revised staple food ordinance. So we think that this potentially creates a really interesting natural experiment. It creates a really interesting situation where we're introducing big improvements potentially to the store environment, particularly, again, to corner stores and small stores. The stores that we think are going to be most affected are stores that are not participating in WIC already. The criteria that I outlined before, the proposed criteria are all generated from WIC minimum stocking requirements. As many of you know, WIC, if you participate in the WIC program, you're required to stock certain kinds of foods. And so the city drew largely language from those requirements that are already on the books. So we think that non-WIC corner stores, gas marts, pharmacies, dollar stores, et cetera, are going to be the most affected here. In terms of a timeline, the health department has been working on this for quite some time. And the most recent timeline is they've run most recently listening sessions with industry reps this summer. In October, we have a date set for a public hearing on the issue for a subcommittee of City Council, and then City Council vote is expected in November. Assuming that it moves forward from there, the health department is equipped with funds from the state through our statewide health improvement program to sponsor a variety of educational activities and training and resources to store owners to really get them prepped and ready for this change in regulation, and taking a lot of the lessons that they've learned in their Healthy Corner Store program and utilizing them here. And then finally, if passed, the ordinance would be implemented in April 2015 with no enforcement and just feedback to store owners, and enforcement would commence in April 2016. We are also, in that we had a strong relationship with the health department, we knew this was coming down the road, we were able to apply for some NIH funding to evaluate this natural experiment and to see what happens as a result. And so my team has already been out in the field collecting some pre-baseline pilot measures. We're now, just as of last week, started baseline assessment before the policy passes. And then if the policy moves forward, we'll be set to evaluate 4, 12, and 24-month outcomes. We'll be looking at changes in the food environment itself, changes in customer purchasing, and then also changes in the home food environment for people that frequently shop at corner stores. So I think this is it's a really interesting opportunity here. we have opportunities to think about how federal policy and changes in federal policy could inform whether or not this program would succeed, right? So as many of you know, the WIC program changed its minimum stocking requirements in 2009 to require a whole load of fresh foods within its package, and also required stores to carry these fresh foods. And we can look at the successes and challenges of store owners who participated in WIC during this time to say maybe that can give us some insights into what's going to happen in stores with the Staple Food Ordinance revision. So just as a quick example, we, as well as a number of other research teams, evaluated the impact of changes in this 2009 WIC policy on small store owners. We, through the Robert Wood Johnson Foundation Collaborative Network, we did a mixed methods study where we had in-depth interviews with store owners and then also quantitative interviews as well across 8 cities in the US. And we found that by and large, it seemed like store owners were able to cope with these changes, especially at a year out. They faced a number of challenges, but from what we heard, they were able to overcome these challenges in a variety of ways. So just as an example, 75% reported that fresh fruit sales increased, 69% reported that fresh vegetable sales increased. The owners said things like, I think it's positive changes, our grocery sales improve and are gaining up. The juices are selling more because they have more flavors, people can choose. So really, I won't read the second quote here, but you can read that. Really, it seemed overall, again, I don't want to kind of hide the fact that there were challenges identified, but the store owners presented them generally as manageable, that these opportunities are manageable. And although the WIC program certainly is different than what we're proposing in the Staple Food Ordinance, in that there's a built-in demand for these products through the vouchers that are offered, we think that there potentially are some insights here into how this could play out. Finally, there's one other issue that I just wanted to mention that we're now facing on a federal level that the Minneapolis Staple Food Ordinance could potentially inform. We have the Supplemental Nutrition Assistance Program, or SNAP, formerly known as food stamps. There's over 100,000 stores in the United States that accept food stamps and are convenience stores or corner stores or small grocers. And currently, there are minimum stocking requirements for SNAP retailers, but they're nothing like the WIC minimum stocking requirements, okay? So through SNAP, these are the requirements that are on the books right now. Stores have to offer 3 varieties across 4 staple food categories, which you see, with perishables in 2. And in the 2014 Farm Bill, this language was increased to 7 items in 4 categories, perishables in 3. But no increase in kind of the nutritional standards of these foods that are required. However, through my conversations with the USDA, I understand that USDA can implement standards that do integrate more nutrition criteria, and they are currently considering revising their staple food or their minimum stocking requirements to include things like whole grains and other products that align with national guidelines. I just want to show you 2 slides based on some of our pre-baseline pilot data that we collected in preparation for the Staple Food Ordinance data collection, which we narrowed down to look at SNAP participating stores only. So these are stores that don't participate in WIC but do participate in SNAP. We had 91 out of our 120 that were in this sample. You can see a mix of all kinds of different stores in this sample. And what we saw, again, kind of echoing other data, are that there's limited healthy food availability across a variety of categories. These bars represent just the % of stores that had any food available in these categories. And so we see a number of stores, for example, particularly in relation to fresh vegetables and whole grain products, 30% or fewer of stores where people are redeeming SNAP benefits are not carrying these products. So Stay tuned on this. USDA will be opening up for public comment on whatever rulemaking they move forward with. That, as I understand it, should be coming out before the end of 2014, so we should hear about that soon. USDA is also considering a range of other strategies that can be employed within stores. We have data on a variety of those, so I don't have time to tell you about that today, but other ways that store environment could change to help shift behaviors and help encourage SNAP participants to purchase healthier foods, particularly in these venues. So just to sum up, we think corner stores are important areas for intervention in these communities. There's a lot of opportunities, but a lot of challenges in these retailers. Important to consider both program and policy side when we're thinking about efforts in these places. I also just wanted to highlight that we've had an incredible amount of success through a really strong partnership with our government partners. So the government-university partnership, in our case, has been really critical to what we've been able to do. And it's been really beneficial to answer our key research questions and inform different perspectives in thinking about local versus national policy. And can you use one to inform the other and vice versa? So finally, I just want to acknowledge our support from the statewide health improvement program, which funds the health department, healthy eating research, Johns Hopkins Global Center on Childhood Obesity, as well as the University of Minnesota, and the number of collaborators and people who have worked and contributed to this work. So thank you.